Hi, my name is Dr. Jay Bernstein. I'm clinically trained in emergency medicine, and I currently work in academic medicine right now. And I want to talk to you about a very novel way of approaching a very common problem. We're going to talk about basically the common cold. Okay, and let's see how it's normally treated and and what we can do better. I want to focus first on the idea that a respiratory tract infection has significant impact on you, the American people, society. We're just going to hone down, just focus in on RSV, which stands for respiratory syncytial virus. There are many other viruses we can talk about. In fact, RSV doesn't have the most impact um, epidemiologically, but we're just going to just look at that one and just to think about things for a second. So the CDC tells us that um, RSV accounts for 100,000 to 150,000 hospitalizations per year. And if you look at influenza, it's probably 2 to 3 times that amount. And that's not including all the other viruses, respiratory viruses. Um, the hospitalizations doesn't include just people who don't get admitted to the hospital, but just they're out of work. How about just the aggravation of feeling miserable and sick? Even if you don't go to the hospital and you don't miss work, um, the numbers are really growing in terms of the impact on society. And this is just one virus, right? The number of patients who actually die from this over the age of 60 is 6,000 to 10,000 people per year, just over the age of 60. Then you have infants and children, and RSV is obviously the most dangerous for infants. So all these other populations had the same problems as well. So what? So what's the big deal here? We treat this in medicine all the time. Primary doctors treat it. Um, Emergency departments treat it. So here's the first question I want to ask. If a patient goes to the doctor's office or urgent care emergency department with a respiratory viral infection, is the doctor trained to recommend a treatment that's going to resolve it more quickly? That seems to be the expectation when a patient comes to the doctor. When people come to me, they think what I'm going to do for them is going to make them better faster. The answer is no. And we're going to look into that in a few minutes. Now, if a patient presents to the doctor's office, urgent care, emergency department with a respiratory viral illness, do the providers always prescribe a medication, a pharmaceutical? Anyway, that's not a cure? Yes, we do. All the time. That's standard practice. Now, is there a cure? Is there a cure for a viral illness, a respiratory tract illness? If I told you there's a cure, and I told you that the same cure can prevent and possibly even be a cure for cancer, would you believe that? Many people at first glance won't, but we're going to pull back the curtain here, and we're going to talk doctor talk. Okay, I'm going to try to make it as relatable and also as straightforward, so everybody can understand the doctor talk. So we're going to start with the case. Doctors like to talk about cases all the time. So this is a case of John. He's 24. He's a 24-year-old male with no past medical problems. He presents with 4 days duration of cough, nasal congestion, weakness, exhaustion. He normally exercises. He's a young, healthy person, can't exercise. He's feeling pretty miserable. He goes to a primary care doctor on Monday. The primary care doctor orders an influenza test, a COVID test, a RSV test, respiratory syncytial virus, the one we talked about, mycoplasma, which could be treated with an antibiotic. Potentially, it sometimes mimics a virus. Strep test, which is kind of ridiculous because it's probably not strep, with nasal congestion. In any case, they're all negative. So who prescribes Mucinex, ibuprofen by prescription? It says return to return to the office if he's feeling worse. He gives him off work till Friday. Friday comes along. He's feeling worse because now he's coughing up what we call sputum, which is like kind of green stuff, right? So the doctor thinks he hears an abnormality in the chest, lung sounds by a stethoscope. He orders a chest X-ray. It's negative. So because now the problem's a cough, the bigger problem's a cough. He prescribes Tessalon Pearls, which is for cough. And then he says, it's Friday, the weekend's coming up, I'm not going to be around available. Go to the ER if you're feeling worse. So then on Sunday, he realized he's been off work for a week. He wants to go back to work. He's losing money. He goes to see somebody like myself in the emergency department. And that's on Sunday because he wants to go back to work. He's had enough. And what he's really looking for is what a lot of people come to the doctor looking for. He really wants a Z-Pack. He thinks the Z-Pack is going to get him better. So he waits 1.5 hours in the waiting room, waiting to see a board-certified emergency physician. The ER physician wrote some blood work, chest X-ray, Here is some blood work, a chest X-ray, some more swabs. This time he just orders the influenza test and COVID test. Guess what? The results are negative. Okay, so we're in the practice of medicine. We are incentivized to make sure the customer is happy, right? So we want to we have customer satisfaction scores, and reimbursement is based on that. So of course the ER physician is going to prescribe a Z-Pak because that's what he wants. So he gets a Z-Pak for his viral illness because the Z-Pak treats a bacterial infection, and it's not going to treat his virus, but he gets a Z-Pak anyway. And he gets an albuterol inhaler, thinking that may help him, even though he has no history of asthma, with a spacer. So the flubs primary care doctor. So he's kind of like playing ping pong with the patient. You go to the ER, go back to primary care doctor. This happens. This is standard practice. I want you to keep this case in mind for later, because after what I present to you, we're going to analyze the case again. So this case that I presented to you is a really very typical situation for a primary care doctor, emergency physician. I have no reason to question their training, their clinical practice. They both practice standard of care medicine. And think about the magnitude also of this problem. Again, I just want to remind you, feeling miserable, aggravated, people miss work. Potentially, people could have hospitalizations and death from the kind of problem. This is why they're told to come back, go to the ER. The doctor's worried about, missing something that may get worse, which is natural. So, I just want to, so before we sort of enter into the science part of it, to really convince you that there's something else we could do that's much more powerful. I want to just remind you that, I have very standard training from very, very good places, undergraduate medical school, residency, postgraduate, other residency training, including a master's in public health, for very, very good places. And I'm using the tools that were given to me to derive what I'm going to tell you today. And these just so you know, these views just represent my own. They don't represent the institutions, but the institutions gave me the tools to be able to really reveal this amazing, really eye-opening information I'm going to share with you. So, if the first step is that I was thinking about the vaccine, the COVID vaccine, the elephant in the room, right? And there's a paper that came out that was that I took note of. There's a physician named Dr. Peter McCullough, which a lot of people have heard of. He's like a world expert now on COVID. He started off as a cardiorenal expert, and now he really pretty much has COVID. He pointed out this article, and when I saw that he mentioned it, I looked it up and I printed it off and I read it. It's called the SARS-CoV-2 Vaccination and Multi-Hit Hypothesis of Oncogenesis. It's from a journal published in December of 2023. And I want to make clear to the American people that when in the practice of medicine, we practice based on evidence that's in the scientific literature. So in which the government database is called PubMed. That scientific database, okay, is the basis of all medical decisions, all medical treatments. It all comes from there, from the science. The question is, are you a doctor if you're just going to accept what we're being told how to practice and what to think, or do you actually look into the literature yourself and evaluate treatments based on the literature? Well, I'm of the latter. So I looked it up. I looked up this article, and what this article shows is that the COVID vaccine causes cancer in multiple ways. Okay, and that's what this article is about. It's all referenced. It's a great article. Now, being somebody who's a little bit older in the years, my basic science is a little bit, like 25, 30 years old from college and medical school. So there's a lot of things I don't know. There's a lot of things that, I need to try to keep up on. What we're doing when we give the drug interferon is we stimulate our immune system. By doing that, we can actually cure a virus that a person has that normally would be problem. So it's pretty significant drug, very expensive. Interferon alpha, when I checked it out, is at $10,000 a treatment. Interferon beta is $22,000 a treatment. I know they're marked up, but that's been the hospital charge. Very expensive drug, and very, very, very powerful. Not only does it treat it, hepatitis, other curative bolus and severe virus of chronic illnesses, pre-cell multiple sclerosis, and it treats cancer that we'll see in a few seconds.
But I know that you just are going through the article and keep it real simple. I don't want to kind of get bogged down in the science, but I need to point this out that uh, this article I started looking at this thing called polarized receptor, right? So I didn't know about that, but that wasn't known when I was doing my basic science years ago, and the total like receptor is basically related to the Chiron. Yeah, this article is showing you that the Chiron levels have plummeted people who have had the polio vaccine, and is one of the mechanisms by which that the polio vaccine causes. Yes, there's multiple mechanisms, such as one of so it's pretty interference pretty critical not only to our immune system fight infection, but also to to prevent ourselves the cancer. Another question is this it sounds kind of crazy because a lot of people think the COVID vaccine was good, right? They think they were told by Fauci that it was gonna be great things for you. It was no side effects. Well, is this paper that I just showed you for December 2023 fake news? Well, let me tell you something. There's 255 references, okay, in this article, all from PubMed. There are 255 publications, okay, that back up all the claims that are made in this article. So this is not fake news. This is real science. You cannot make up that many authors, that many articles. Just can't be made up. It's science. All right, so I just wanted to show you just again some more scientific basic for the power of the era. This is a paper that was published in 2022 that shows it looked at 194 articles that shows that interferon can prove many respiratory viruses. We reduce the viral counts, severity of many respiratory illnesses, duration of many viral illnesses. There are different ways they've looked at it. I'll just show you some brief data from the article. Again, you're not going to get bogged down in it. I surfaced the taser. It shows you the black circles detected different respiratory viruses they looked at. And on each of these studies, this is just a snippet of some of those 100 medical articles. Referring the A and the parainfluenza, adenovirus, rhinovirus, respiratory virus, COVID virus, rhinovirus, and then the red, all the different ways the outcome measures, the all different, showing improvement. Ready? Let's say here. Now let's look at cancer. Lots and lots of data on cancer. In each chart. By the way, it's good is used because we'll see in a second. But for example, it is FDA approved as an adjunct therapy for melanoma. Or in cancer, if the cancer treatment like chemotherapy is failing, and they give the patient interferon. Interferon improves outcomes. Okay, it improves outcomes in cancer patients. The question is, does interferon improve outcomes in patient with cancer normal without any chemotherapy? Well, chemotherapy is standard treatment. You can't withhold standard treatment. Generally, you cannot withhold standard therapy to test a drug on a population. So it can never pass any ethics board. So it's used as an adjunct. Because the standard is chemotherapy. But we know that interferon still hunts those patients who get chemotherapy or radiations. And then I'm just listing all these there. Some article that showing you the references in this article, pictures that it's a summary article. Reducing tumor, inhibit tumor growth, decrease tumor, suppress tumors, that's etc. And this is just more of the article. By the way, I just pointed with that red arrow. This is a lot more as another list. Continuation of the list of this article. Then it starts looking at the current data. We already talked about beta. We're talking about Tibetan alpha. By the way, what we're going to go to, and I'm going to show you the reason treated for treating the usual garden variety respiratory illness that could be things like this therapy will help alpha and beta. Well, okay, this is a graph. This is a picture from another published article in Science TV showing that basically and there's different mechanisms by which it can on real stop tumor growth. Vegetation is circle of purple. Again, I don't like it too bug on it. There's something called apoptosis, which is this random cell death. We don't know why it happens. Does that. Interferon does that. Tumors. It stops angiogenesis, which means it stops the growth of the blood vessels into the cancer cells. They need blood vessels. So interferon stops that. Interferon stops the cell-to-cell adhesions, okay, which in cancer cells, where you sort of dances. Also, the immune system that it tries to invade, your own immune system, well, it enhances your immune system So you go against the tumor, and it also inhibits the tumor's ability to evade the disease. So it also another counter there, you have the right corner there, about energy. So generally, in cancer, this is all published data, by the way. Cancer cells utilize a different energy system. Generally, they use a cancer system. They use an energy system based on because normal cells use energy from the mitochondria, and this is one very fun topic that should be in the forefront of oncology. And I think it's known, it's sort of developing, but it's like it's so powerful, such a powerful mechanism. Addressing cancer in this way should be much farther along than it really is. Um, so interference, as I said, there's many studies showing the interferon helps, to cure or to increase many cancers. It happens to be FDA approved for that I'm aware of. Aerocellular cancers, leukemia, lymphoma, Kaposi sarcoma, chronic problem, pneumonia. So knowing all this about interferon, I told you about interferon. Okay, now you're an expert in interferon. Now the question is this. This is what I asked myself. What can I do to naturally increase my own body, my natural interferon? And we can go into many examples that if I can enable your body to produce something naturally, it's always much better than if I give it to you, what we call exogenous thing, in other words, by a drug. Okay, the drugs are never going to be as good as your natural bodies, whatever it is. Okay, there's many examples, but we don't have time for that to talk about that. Just want to point that out. So what increases interferon naturally? Okay, lo and behold, first thing I pulled up under PubMed, 2007 article on gallbladder. Gallbladder increases interferon alpha. And what this in the abstract that tells you here, I circled it. It says that your interferon alpha levels at the basis population tissues goes from 9.5 to 46. Okay, in 1 week, taking 2 grams of garlic per day for 7 days. 2 grams is about 2 to 3 kills. Do you even eat that? By the way, it's grab garlic. I mean, you cook the garlic, it destroys a lot of the molecules, gets to over 40% effective. So have a raw garlic. That way, you got to chew the garlic. I mean, and everything I'm telling you is evidence based, all literature, by the way. Okay, I'm going to chew the garlic. Why? We'll see in a second. Or when I go through the chemical reactions of the happens. Okay. So this is another graph from the same article showing that after you take 2 grams of garlic, that circle it there. After 4 hours, you get a blood level of 50.4. Okay, if you double that to the 4 grams, you got a little bit more. So really, the biggest sort of the most efficient way, they say, well, you minimize the amount of garlic you're eating. Garlic's pretty hard to eat. You take 2 grams, you increase your level by almost 5 times. Okay, so this again, the same article looking at another way of looking at it, where they take 2 grams. Actually, they take 2 grams of garlic, and looking at, sorry, well, how it increases the level in the blood over time, and so you get 2 hours, it goes up, 4 hours, it goes even higher. See that it goes from as there's like 9 to 50s, gone in a 4 hour period of time. And then the graph on the right shows you that if you take 2 grams of garlic, that it'll continue going up until about 2 days. So when you take the garlic, it'll last for 2 days, and then the level starts dropping off. So if you take garlic every other day, you're going to keep your levels up. And I just wanted to again make this point that you go from 9.546 up to 4.9 increase in 1 week of interferon, which is very expensive and very powerful drug. I went into another topic. Okay, this is also going to be related to garlic. We want to talk briefly about free radical oxidation. A lot of people have heard about that. Free radical oxidation. Most people have heard that. No, it's not a good thing in the body. It causes a lot of. Yeah, it's really the underlying mechanism by which many different chronic diseases, chronic diseases, and cancers work by destroying human cells. And in any case, so the free radical oxidation causes something called ROS, reactive oxygen species. Well, reactive oxygen species, it destroys cells. So your immune cells are, like those cells, by infection weakens immunity, right? Which increases the risk of susception. It increases the susceptibility to infection when it has reactive oxygen species. And also, when we are able to cure clear infections, or naturally, when your body's trying to create cancer is sort of developing and get under control. It's the many different things that are happening, but but one very significant thing that's happening at the same time as the RSS is do its job. So the RSS visualizes the ROS. That's what's happening. The RSS in our body, that is the main um, mechanism, that the main molecule that's at work is called glutathione. Glutathione is a tripeptide. It's made of many different amino acids. Um, and it's abundant in our body, and that's what's controlling the free radical oxidation. And when you have enough GSS, right? I'm sorry, GSH rather. That's what the literature peak uses as an acronym for glutathione. Uh, it initializes the ROS, and therefore then you help initialize the infection because you're making sure the cells are not being damaged as much. That improves infection, improves cancer. This is a graphic for basically an the kind of article just to show you this is all science. It's not just me saying this. Okay, on the left there, so there's a ratio, there's an interaction between VSH and GSSG. That's for the redox potential. So if GSH to the GSSG is 100 or rather better, that's a healthy cell. When I say 10 to 1, that's a cell that's susceptible to a lot of damage, maybe it'll die, or function properly. So when you want to replenish your GSA, your glutathione. That's a really key thing. So the second one there on the right hand side, which shows that GSH can go to the left of the M. It said that's a mitochondria. It goes to the N, which is the nucleus. Goes to the ER, which is the endoplasmic reticulum. The GSH be the cell to help other cells, and it's good. And what the GSH does is it helps repair the mitochondria, the nucleus, the endoplasmic reticulum. That's our cells when you repair repair ball. Very important. Okay, just another just a way to see to sort of grasp pods up here. From the example of the white blood cell, which fights immune cell, which is part of our immune system that fights infection. So the neutrophil, which is a white blood cell, in the pink, it's good if one has a low GSH to GSSG ratio, or the IL-8 and the IL-9 beta, those are signaling molecules, cytokines. And they signal to help it migrate. So if that ratio is low, you don't have a lot of glutathione, these white blood cell won't migrate to where it needs to go. It won't function properly. Okay, again, published data on PubMed, right? So, and the other one's called the macrophage, BULA. That has a low ratio, low glutathione. You can't hit both things. Okay, it can't communicate with the natural killer cell, the NK cell. Because the IL-2 or the interferon gamma are weakened when they don't have that GSH. So you have a low killing. You have a low ability to kill the infection. Okay. So that's just again example in the literature is to prove the point. And this is just another article showing you that that glutathione's involved in a lot of different cancer treatments, that in cancer mechanisms. And this article just all these numbers in the bottom box tells you all these different articles showing how that glutathione's involved in cancer. It's a very, very important molecule as well. We've got interferon and glutathione, very important molecules in the body. And so this is one that's showing again glutathione pool, they call it, which is you want glutathione. One of the ways in which you can replenish the glutathione here, circled in red, is nutrition. Okay, and lo and behold, we got another article here from literature. Okay, published in 2009. It's known for a while. Well, allium sativum is the Latin word cacao. It increases glutathione gains. To that. So the graph in the middle, just that's sort of a graph in which the levels of dollar bone monocyte system down. And 15 seems to be the optimal. So they use that as a blood where on the all the way to the left, where with the cell cultures, how it glutathione can be released by putting a certain amount of allicin, which is the component bolic, in the cell culture. And in about 24 hours, you peak out, and then it goes down. So 48 hours, you sort of halfway down that curve. So in other words, you can release glutathione, enhance the production, I should say, of glutathione by these cells, by seeing out the allophane, putting allicin in kind of cell culture, which is the big component of folic. And then this other one on the bar graph shows you that you could, if you take these 15 micromoles of allicin every other day, okay, it maintains levels even up to 10 days. So you maintain your levels at glutathione up to 10 days, which is every other day exposure, okay? So I just want to just kind of point out another thing, regarding supplements. What can we do to increase our glutathione by supplementation? And I'm just going to give you one example because this is, this seems a little bit far-fetched in terms of whether or not this idea that we can actually improve our immune system by, right, by correlates of, we in the practice of medicine, we have a really good example. It proved the point that not use glutathione levels, you can actually do something real with somebody. Okay, so normally when people take Tylenol, okay, the Tylenol is breaking down in the liver. That's why people with liver problems should take Tylenol, right? So, but one of the components it breaks down to is something called NAPQI. That's the days. Okay, that's the bad. It's only about 5% of the metabolites. So when that molecule is produced, it destroys the liver. How is it? How do we or countervactalize naturally get rid of that? Is that destroys the liver? See, but we use glutathione to break it down, right? So somebody has a Tylenol overdose, and that's deadly. If someone overdoses of Tylenol, it may take weeks or months without treatment. If you take enough of it, I don't tell you how much because I don't know anybody do it, but um, after a certain amount of Tylenol, okay, a person will destroy their entire liver and it will die unless they get treated with the antidote. What's the antidote? N-acetylcysteine, which is actually an over-the-counter buffalo. So it's N-acetylcysteine. What that does, it replenishes the glutathione. That's how it works. Because glutathione, that molecule that breaks down that really bad chemical called NAPQI, you deplete it. When you have a Tylenol overdose. So if you can replenish it or take an N-acetylcysteine that replenishes the glutathione, then we can cure a counter overdose as long as it's taken fairly quick, within say 6 to 8 hours. Okay, so it's a pretty amazing treatment. It's over the counter. It's a supplement. It increases your glutathione. So I want to just kind of just show you I'd like to stick to the data. I'm going to take a scientific approach because that's the system I grew up in, and that's how I think. So I want to know what is it in the blood that increases interferon and glutathione exactly. Well, here the chemical or the reactions have been worked out. This came a paper, I think, from South Africa, but there's been a few papers that's showing this kind of thing. Does replace papers where you have something called allicin in the garlic, and then alanase. I draw that line. It's an enzyme called alanase. Both those are compartment in the garlic that are separate compartments that are not hearing anything. It cannot be mixed together enough what unless you chew it. If you chew the raw barley, alan and alanase mixed together creates just other molecules. Two of those makes allicin. So you get alan plus alanase makes allicin. You get allicin, okay, that stimulates your immune system. That is what's causing the increase in interferon in glutathione. This is real science. This is not quackery. This is not this is kind of weird. This is real stuff. And noticing that there, and then the allicin then breaks down in certain situations. You have to let you have to let the molecules sort of do the thing one way. There's a number of ways to do that. But after a short period of time, the allicin breaks down into 13 more molecules that are all stimulating your immune system that help your interferon alpha and your glutathione. We haven't talked about interferon beta, by the way, which also you can enhance this, and also electropulsate. Well, some of all. It's like, well, no, I'll do it. No, I'll. It's like, and so just after this really eye-opening experience for me, because I discovered this all on my own by looking into carb meds. And I would venture to say, based on my own experience, is medical education. There's very little, if any, teaching of glutathione in the medical scheme. All right. So anyway, I read the literature. I'm thinking, I was thinking to myself, when even on this, when even knowing that garlic is actually beneficial. Well, I found an article. I found the article that the first I had to find, 1944, was published. And then I read the article, did it off of Reddit. This is the first page. Bought it to Chrysler Computer. So interesting that they use the same assay, the same test that they use for penicillin. The penicillin cures bacteria. In garlic is equally effective.
Okay. But what's really strange in this article, I just happened to notice above it. There's a red line they put around it. I wrote you probably can't see it, but I'll tell you what it says. There's a molecule called diethylstilbestrol. Now, I think all the doctors here remember that, right? Because we're taught medical school, and even today they're still taught in medical school. Since we're taken off the market in the 1970s, what it was market. It was created by a drug company. Therefore, you can get a patent on it. Guess what? You can't get a patent on garlic because it's natural. Okay, okay. So the diethylstilbestrol, because it's an estrogen-like molecule, they theorized there was no evidence for it. They theorized it was going to prevent miscarriages, so they marketed it to prevent miscarriages. Guess what? The daughters of the women who took it had this very unusual vaginal cancer, and the reason why they were able to link it is because the vaginal cancer was so rare. It was just then all of a sudden these cases were popping up everywhere, and the common theme was their mother had DES while they were in utero, while the mother was pregnant. So eventually, by the way, it caused many other cancers too, not just that unusual, that very rare vaginal cancer. So this was discovered in 1944. At the same time, garlic was known to be antibacterial. By the way, it's antiviral and it is antifungal as well. And so this is the drug called diethylstilbestrol. Does this make any sense? Anyone? Does it make any sense that we're going to have this drug? They based this theory and marketed it and give it out to patients that want to start doing all this harm, yet garlic's ignored. For most allopathic doctors, osteopathic doctors, nurse practitioners, PAs, doctors prescribe garlic. Okay? Why only a pharmaceutical cure? That's my question. I'm trying to figure out the reason for it. Maybe somebody could make some suggestions to maybe. So let's go back to that case. I do remember the case. I'm going to close up here. Let's analyze the case that we went through. Okay. There was the 24-year-old John. His name's John. Previously healthy male, cough, congestion, root tired, doesn't want to exercise. He's feeling miserable. 4 days. He goes for another week of being sick. On Monday, the primary doctor's visits. What's on the test he ordered and a prescription? $1,500. Okay. I included the with you exam for it. I estimated to say his week of work was $1,000. Made $1,000 a week. Okay. That's a $1,500 price tag. Okay. Friday follows up $250. Okay, between the visit, the X-ray, the prescription. Sunday, use here $3,000 visit plus the antibiotic that you didn't even need, because it's for Z-Pak does not treat viruses; it treats bacteria. $3,120. Now, did he follow up this primary doctor like he was supposed to? We don't know. Maybe he did. Maybe he did. He did that. He had that cross, but let's assume he didn't. So he did follow the doctor's instruction. Well, that virus costs $4,870 plus all the aggravation of being sick, all that types. Now, the question that I just answered before, why is it? Well, the ostensible answer here is that medical school training is basically promoting pharmaceuticals. I'm not saying all pharmaceuticals are bad. But what I'm saying is that it's a little bit lopsided. We need to really start looking at the evidence actually in the scientific literature that helps people that may not be a pharmaceutical. Okay, it's caught in the continuing medical education or certifications. It's standard medical practice. That's why we practice that, man. Okay. Question is, how do we get there? How do we get here? Oh yeah, how do we get here? Okay, that's my biggest question. How did we get here? Without question. Well, all I can say is this: the garlic costs a lot less money than $4,870. If he had taken garlic, fresh garlic, chewing it, okay, these 2 grams a day, okay, he would have gotten better quicker. He would get back to work faster. It'll be a lot less aggravated. It doesn't be visible for that period of time to a sick. Thank you very much.